The second case that I'll be presenting is a patient with advanced colon cancer with no molecular alteration. So this is a patient, a 35-year-old gentleman who was referred to gastroenterology for symptoms of acute abdominal pain and intermittent constipation. Physical examination shows some abdominal distension, decreased bowel signs, and pain in the left side abdomen area. CAT scan was done, which shows focal enhancement and some thickening of the sigmoid descending colon, and then pericolic fat stranding, and 3 small liver lesions that's greater than 1 centimeter. A scope was done, and the biopsy was confirmed to be well-differentiated adenocarcinoma. The molecular testing was done as per guideline, and the patient was found to be RAS and BRAF wild type. And the patient was, at the time, was started on FOLFOX plus cetuximab as a palliative chemotherapy. Now I'll be discussing some of the data that was presented recently at ESMO. So this is a benefits of upfront primary tumor resection according to sidedness in metastatic colorectal cancer. This is a retrospective analysis of MACR-2 and the planned randomized trials. So in this study, they looked back and looked at the patients who were KRAS wild type, and they looked at patients who had upfront resection of the tumor. And what they found was that in patients with stage 4 patients, the upfront tumor resection was associated with improved overall survival. However, it was only significant in the right-sided tumor. The median overall survival of the right-sided tumor that got upfront resection was 20.9 months versus 10.6 months. The left-sided tumor had a better overall survival regardless of the upfront resection or not. And as you could see from here, the hazard ratio is 0.4 with p-value being 0.006, telling us that in left-sided tumor, it really didn't matter whether you had upfront resection or not. So now we're going to look at the primary tumor location as an independent prognostic marker from molecular features for overall survival in patients with metastatic colorectal cancer. This was an analysis with CLGB SWOG 80405 study. So in this study, what they found was that out of all the patients, 720 patients, the sidedness was an independent prognostic factor when adjusted for age, gender, CMS, MSI, or BRAF status. Patient with left-sided tumor did well overall. It was, the overall survival was close to 33 months compared to 20 months in the right-sided tumor. Now, the question is a sidedness also a predictive marker for possible biologic therapy? And in this study, they found that patient who got BEV plus chemotherapy showed a 38 months overall survival in the left-sided tumor, compared to cetuximab-based therapy, where there was a slight improvement over survival by about 40 months, by 40 months, so improvement about 2 months improvement in overall survival. However, in the right-sided tumor, the patient who got BEV plus chemotherapy had overall survival of 34 months. However, patient who got cetuximab had a worse overall survival of 18.4 months. Next, I'll be discussing the Valentino study, which is a maintenance therapy with panitumumab. So this is a first-line FOLFOX plus panitumumab, followed by 5-FU-leucovorin plus panitumumab or single-agent panitumumab as a maintenance therapy in patients with RAS wild-type metastatic colorectal cancer. And this was presented this year at our meeting. So the patient with RAS wild-type unresectable metastatic colorectal cancers were enrolled. There were a total of 229 patients. And they were basically randomized to FOLFOX plus panitumumab for induction for 8 cycles. Then when they have stable disease or partial response, they were actually randomized to maintenance arm with panitumumab alone or panitumumab plus 5-FU-leucovorin and they continue until progression or unacceptable toxicity. And the primary endpoint of the study was non-inferiority of PFS of arm B versus arm A. And the secondary endpoint, they were looking at safety, response rate, duration of response, and overall survival. And at the median follow-up of about close to 14 months, the 10-month PFS of the panitumumab arm was 52.8 months versus 62.8 months with a combination of 5-FU plus panitumumab. And the median PFS favored the combination of 5-FU panitumumab by close to 3 months, from 10.2 months versus 13 months. Overall response rate was very similar. And in terms of during the maintenance therapy, the grade 3 adverse events that occurred were diarrhea, mucositis, and hand-foot skin reaction, and neutropenia. And grade 1, 2 adverse events were 75% in arm B versus 64% in arm A.